Art therapy. Topics to be covered in this module. What is art therapy? What art therapy help with? Benefits of art therapy. Effectiveness. Art therapy is not for everyone. Art therapy techniques and exercises. Limitations and concerns with art therapy. Summary. Introduction. Art therapy is a separate field that uses the visual arts as a medium for expressive creativity. The definition of art therapy, a creative arts therapy profession, can vary. It has its roots in the fields of art and psychotherapy. Art therapy has three uses. Art therapy is first. Analytical art therapy is based on analytical psychology and psychoanalysis. Analytical art therapy focuses on the client, the therapist, and concepts transmitted via art. Art psychotherapy is another form. This method stresses the psychotherapist's verbal interpretation of the client's art. Finally, art therapy is seen as therapy. Some art therapists who utilize art as therapy prefer to focus on the artistic process above verbal analysis. The art therapist's client uses paint, paper and pen, clay, sand, fabric, or other mediums to explore inner thoughts and emotions. Art therapy improves self-esteem, self-awareness, emotional resilience, and sensory motor function. It may also reduce conflict and tension. Art therapy uses person-centered, cognitive, behavioral, Gestalt, narrative, Adlerian, and family theories. Art therapy promotes humanism, creativity, emotional healing, self-awareness, and personal growth. What is art therapy? Art therapy is the practice of using creative techniques to treat psychological illnesses and improve mental wellness. The practice of art therapy is based on the notion that artistic expression can promote recovery and mental health. For thousands of years, people have relied on the arts as a means of self-expression, communication, and healing. But it wasn't until the 1940s that art therapy began to evolve into a formalized program. Drawings and other artistic works were frequently used by people with mental illness to express themselves, which encouraged many doctors to consider using art as a therapeutic technique. Since then, art has grown to be a significant component of the therapeutic community and is used in several evaluation and treatment methods. What art therapy can help with? Art therapy can be used to treat a variety of mental problems and emotional suffering. In many instances, it may be combined with other psychotherapy techniques, such as group therapy or cognitive behavioral therapy, CBT. Some conditions that may be treated with art therapy include age-related concerns, anxiety, cancer, depression, eating disorders, emotional difficulties, family or relational issues, medical conditions, psychiatric symptoms related to other medical conditions, trauma-related stress disorder, PTSD, psychosocial challenges, stress, substance use disorder. Benefits of art therapy. According to a 2016 study published in the Journal of the American Art Therapy Association, less than an hour of creative work, regardless of artistic experience or aptitude, can reduce stress and improve mental health. An art therapist may employ a number of art techniques, such as drawing, painting, sculpting, and collage, with clients ranging in age from toddlers to the elderly. Creative expression can aid clients who have undergone emotional trauma, physical violence, domestic abuse, anxiety, despair, and other psychological difficulties. The following are instances where art therapy may be utilized. Adults suffering from extreme stress. Children with school or home-based behavioral or social problems. Children and adults who have undergone a terrible event receive counseling. Students with learning difficulties. People who have had a brain injury. Individuals with mental health issues. Effectiveness. Even though research suggests that art therapy may be helpful, some of the findings on its usefulness are equivocal. Citation needed. Studies are frequently underpowered and lack definitive results. Therefore, additional studies are required to investigate how and when art therapy may be most helpful. Studies conducted on adults who had suffered traumatic events indicated that art therapy was effective in considerably reducing the symptoms of trauma and lowering levels of depression. According to the findings of one study that investigated the efficacy of art therapy, the practice assisted cancer patients undergoing medical treatment to enhance their quality of life and eased a variety of psychological problems. According to the findings of one study, older people living in nursing homes who participated in art therapy had lower rates of depression and higher levels of self-esteem. Art therapy is not for everyone. Not everyone is a good candidate for art therapy. Even though high levels of creativity or artistic ability are not required for art therapy to be successful, many adults who believe they are not creative or artistic may be resistant or skeptical about the process. Art therapy is a form of expressive therapy that aims to improve mental health and well-being. In addition, it has not been demonstrated that art therapy is useful in treating all varieties of mental health issues. According to the findings of one meta-analysis, art therapy is ineffective in lowering either the positive or negative symptoms of schizophrenia. Art therapy techniques and exercises. Art therapists who have earned their certification will typically have a deep and thorough awareness of the profound impact that engaging in artistic endeavors can have on their patients. Art therapists frequently combine psychological, spiritual, and artistic theories with clinical approaches in order to attain the therapeutic goals that they have set for their clients. Even nonverbal people and working artists have benefited from using this strategy, which has demonstrated its usefulness. The following are examples of common therapeutic techniques: painting, finger painting, doodling, scribbling, sculpting, drawing, using molding clay, carving, making pottery, making greeting cards, utilizing several types of fabric, making collages. Art therapy techniques and exercises. People who find it difficult to talk about their feelings, thoughts, or experiences can benefit from art therapy. In a 2004 study, 32 women with heart disease were questioned before being asked to describe their conditions in detail. 3 categories were created from the drawings that emerged: the heart in the center, the heart in the lived body, and heart disease as a societal illness. The drawings ultimately helped medical specialists better understand how each lady perceived her situation and gave advice on how to treat each instance. The use of color, spatial organization, and composition was examined. Limitations and concerns of art therapy. One of the key problems of art therapy is the effectiveness of the practice. Even if there are a lot of people who think it works, there are still some who doubt it. Adults, in particular, may not have the tendency to comply fully and honestly with the treatment process, or they may flat out refuse to participate in this kind of treatment altogether. In addition, some people may feel that they are not creative or artistic enough for the treatment to be effective, despite the fact that the purpose of the treatment is to communicate one's thoughts and feelings, not to create artistic masterpieces. Because there is a lack of supporting empirical data for art therapy's success, it is also possible for art therapy to be criticized for its effectiveness. Those who do decide to pursue art therapy as a treatment option may discover that they are required to commit to a predetermined number of sessions before they can begin to enjoy the therapeutic benefits of the technique. One further thing to worry about is the amount of money it will cost to buy the instruments, media, and other things that will be required. It may sometimes be difficult to find a location that is appropriate for the therapy to take place, particularly in cases when fluid media, specialist illumination, or other types of specialized equipment are utilized. Summary: art therapy is the practice of using creative techniques to treat psychological illnesses and improve mental wellness. It has its roots in the fields of art and psychotherapy. Analytical art therapy is based on analytical psychology and psychoanalysis, while art therapy stresses the psychotherapist's verbal interpretation of the client's art. Art therapy uses person-centered, cognitive, behavioral, Gestalt, narrative, Adlerian, and family theories.